Hello and welcome everybody, and thank you for joining us. My name is Helen Corteen. I am the lead for wellbeing and mental health here at Brook, and I'm chairing today's panel. So Brook is celebrating 60 years this year, and ever since we opened our doors back in the 1960s, it was really clear that in addition to the clinical services that young people were coming for to manage their sexual and reproductive health, the decisions that they were making were impacted by and impacted on the rest of their life. So it became really clear very, very early that the space to work out what all that means was as important as the clinical services that young people were coming for. And that's remained throughout our 60 years of being in operation. And it's still one of the things that young people tell us is one of the most important things, that they have the space to work out what things really mean to them in their life. So from our really early days, we knew that our approach had to be holistic and was holistic, because that's what young people needed. And that's stayed the case. But like other services, we're seeing a real increase in the mental and sexual health challenges that young people are having to navigate at the moment. And we at Brook are really keen to offer more, and particularly to offer more to support young people with their mental health, because they were bringing that to us in that space that we create with them. So what we wanted to do was to look at what we're already doing. We wanted to look at what young people were telling us, what we could learn from our service delivery, and what was out there. So we commissioned a literature review, we hosted conversations internally so that we could see just what was our starting point, where sexual health and mental health met, where we were already working with young people on that, and how we could move forward to respond to that. So that was a really rich and important conversation that we wanted to open up and have more widely. And that's led to our theme for Sexual Health Week, which is Are You Feeling It? So that we can look at where those two aspects of health connect. And we're delighted to welcome our panel members here today as part of one of the first of a range of activities that's happening during the week. So if you want to check out our social media channels, you'll be able to see what's coming up and make sure you don't miss any of the other activities. But our panel here, which we're delighted to welcome, they're going to introduce themselves in a second. I just want to explain how the panel is going to work. So we've got some key questions that we're exploring between us, but we want to invite you, as you listen to our panel, have the conversation, just to see where your views, your opinions and your experiences meet with what the panel are discussing. We're having some questions at the end, so you'll see at the bottom of your screen on your toolbar at the bottom a Q&A function. So please put any questions that you would like our panel to consider in there, and we'll be picking that up at the end. So just for all of us, we're talking about issues that affect us as human beings, and so they inevitably cross our personal and professional lives. So we just raise our sensitivity for ourselves and for each other as we talk about these issues today. So we look after ourselves, we do what we need to do. We're all allowed a little treat if there's something that's that can be a bit challenging, and we may want to consider that we might just want to talk our thoughts through after this. So just a little reminder for us. So let's meet our panel. So Emma, I'm going to come to you first and then to you, Natasha.
Thanks so much, Helen, and really, really pleased to be here and really exciting to be part of the panel. And I'm just really looking forward to the conversation. So my name's Emma Rigby. I lead the Association for Young People's Health, and we're a charity that works across the UK looking at every single aspect of young people's health and well-being. So we focus on young people aged 10 to 25, and we are, I guess, really interested, passionate and focused on thinking about young people's health from every single angle. And this is really an amazing stage of life, that has huge changes and huge areas of development. There's social changes, emotional changes, physical changes that young people are experiencing, and that's really why we exist, because we think it's really important that we look at all aspects of their health in positive ways, and really understand what is happening. So we look at the data, we look at the evidence, but we also have young people at the heart of our organisation, so we really understand what young people themselves are saying and their experience today. And I guess just to say a little bit why I think this is really important, really from the perspective of young people. So I've been doing this job for a while, about 15 years, and whenever we have a conversation with young people, their mental health and well-being are things that are central, and they will always come up. So we know this. There's huge amount. I don't need to say more than that. But the mental health and well-being of our young people in this country is incredibly important to them, and is something which they are very preoccupied with, understandably, and is really key. But also relationships are central to young people's lives, and we've done numerous bits of work, and how those relationships work then interconnect with every other aspect of their life and their health and their mental health as well. So it's really key that we think about these issues separately, but that how they connect in young people's lives today is fundamentally important, and that's what I'm interested in having a bit of a wider conversation about. Thanks, Helen.
Great, thanks, Emma. Natasha, and then we'll come to you, Tamsin.
Thank you. Hi, everyone. I'm Natasha. I'm probably best known these days for having a weekly show on LBC. But when I'm not doing that, I go into schools and colleges throughout the world, and I work with year 9 to 6th form. So that's 13 to 18-year-olds. And my aim is to research with them, do focus groups with them, and find out what's missing from their personal health and social education. And then based on their responses, I work with a team of experts in neuroscience and psychology to come up with lesson plans on the things that teenagers told me they wanted lessons on. And usually they're broadly related to mental health in some way. So the kinds of things that I tackle are things like exam stress, body image insecurity, dealing with transitions, particularly the move to whatever is post-18, whether that's university or whatever it is, preparing young people for that. But what I've been finding increasingly over the past 4 years, I would say, is that there's this overlap in the feedback that I'm getting from teenagers about PSHE and RSE, which is their relationship and sex education. So they're talking to me about things like coercive control and red flags, not just in their romantic relationships, but in their friendships as well, and the knock-on impact that's having on their self-esteem and on their anxiety levels. So that's led me into a new space, and also led me to write my 2 YA novels, which are called Toxic and Babushka. And they are both based on the feedback that I got from young people in focus groups about the kinds of topics that they want to explore.
Oh, it's really interesting. Thanks, Natasha. Tamsin, and then we'll come to you, Anna.
Hi, so lovely to be here. Thank you for inviting me to be part of the panel. I cannot wait for the rest of this conversation. So I'm Tamsin, my pronouns are she, her. I am the Senior Safeguarding Manager at Young Minds. I've been at Young Minds nearly 5 years now. Young Minds is a UK-wide charity who works towards better support for young people's mental health. We work with young people up to the age of 25. We also work with their families and also professionals who work alongside young people. And all of our work is driven by young people's voices and their lived experience. So we have worked closely with young people who choose to come work with us, tell us about their lives and what they've gone through, what they've experienced, how that's impacted their mental health and the rest of their lives as well. And the reason I'm here today is because I think sometimes we need a bit of reminding that all of these parts of our well-being and our health are absolutely inextricably linked. You can't just talk about one thing without mentioning something else. And as a safeguarding professional, I can only support and safeguard young people if I understand their whole lives. I need to look at them as a holistic, unique individual with their own needs and their own experiences. And I think that's why it's important for me to be part of this. And I know that I'm going to learn a lot today too. And I think it's also okay for us to say that we're still learning. Like, all of us as professionals, we're never going to know everything. And so being able to have a conversation like this, where we maybe expose some of those things which we didn't know, or we've got vulnerabilities, or we've got our own gaps about, that's also important for us to talk about today.
Yeah, great. Thanks, Tamsin. Anna?
Hi everyone. So it's really nice to hear from all of the other panelists and to be here. I'm really looking forward to the conversation. So I'm Anna. I've worked at Brook for about 8 years as a counsellor and more recently as counselling lead. And so, you know, as Helen was saying earlier, we've really found at Brook that kind of intersection between sexual health and mental health from a really for many years now, but we're really focusing on it. Because we are finding more and more young people are coming to us with more complex mental health needs, even though their first reason for coming to us might be sexual health. And so we're really recognising that we kind of want to do more to support those young people. And as I've been in a role of a counsellor at Brook for those 8 years that I've been at Brook, you know, I've certainly worked with those young people in that really focused way around the mental health. But always under the umbrella of a sexual health charity. So I'm, you know, really mindful of how those things interconnect, and very much that we can't, you know, I think as everyone has said, we can't kind of deal with one part of a person without the other parts of a person being there. So that's why for me this conversation is really important. We want to, I think all of us are really passionate about supporting young people. And we want to do that in a really holistic, wholehearted kind of way. So I think just from that, bringing into this conversation about what we've been doing at Brook, but in the way that we can all kind of learn from each other, as you were saying, Tamsin, feels really, this is such a good space to develop that understanding a bit more.
Great, thank you. And it's great to get to know who we all are and your reasons and to start our thinking as to why this is an important conversation. So as a place to begin, really, although we've all talked about and we're all highlighting just how important looking at young people from that in that holistic way is, it's probably a good place for us to just explore a little bit more our understanding and experience of how mental health and sexual health do interconnect, and what, by thinking about within that holistic context that we're all acknowledging is important and essential, it's the heart of the way that we're approaching it, is just a little bit more about how those two interconnect. So Emma and Anna, you know, for you to start that off and come to you first, Emma, to say a little bit about your understanding and what's important about those two things as part of health.
Yeah, absolutely. I mean, I think we've all talked about it, haven't we? So I think it is really a good place to start. I mean, I think the important thing to say for me first is that young people don't silo their own health. They don't think of it. And I think probably maybe none of us silo our own health. Maybe none of us think about, you know, the separate. We look at how all of these things are interconnected, and that's a particularly young people tell us that all of the time. And yet, as a kind of system in terms of our health system, it is a very siloed system. If we look at the health system, so there are mental health services and physical health services, and whilst we have some universal health services, there is a very much a sense of these things being in separate places. And then that can be a really, really challenging environment for young people to raise some of their mental health and sexual health concerns. And I think the other thing that kind of links these two issues for young people is that it kind of goes back to what you said at the beginning, Helen, about these being sometimes difficult and sensitive issues to talk about, where young people may feel worried about raising those kind of concerns. And I think both in mental health and in sexual health, these are both issues that can be really challenging and difficult to talk about with somebody else unless you have a trusted relationship. So they're both kind of interconnected, and also these issues which can feel in society, unless you have a trusted place to go to, really hard to talk about for young people. So I mean, for for us, there are some, I think one of the things that the perspectives we take on how these are interconnected is really making sure we understand what, what is happening for young people with their mental health and their sexual health. And we should make sure that we're kind of looking at what the data is telling us around that on a universal basis. So, not all of it is really terrible news. There are, underage conception rates, for example, are falling and are some of the lowest rates. There may be some recent data that may be saying that it's going in a different direction, but I think we should be really clear about, the way that sexual health and mental health works for young people and look at what the data is showing us. That is key. But we also need to think then about where are the areas that we should be focusing. And one of the things I think is really important is to look at the inequalities that young people face in our communities. We have recently done a report around young people living in more low income areas. And there are particular concerning trends both in terms of sexual health and mental health of those young people living in low income areas being more affected by, for example, increased higher rates of underage conception, higher rates of sexually transmitted diseases, and also higher rates of mental health concern and mental health conditions. So I think that is a really important lens for us to think about these issues through. And in addition to looking at issues around low income, we also need to think about particular groups of young people. So we know that young carers, care experienced young people will be face particular challenges, and the conversations around mental health and sexual health in particular communities need to be dealt with in different ways, in culturally appropriate ways, and in ways which are going to fit with them and their communities and their peers. So I think probably that is the point I can pass over to Anna. That's okay.
Thank you, Anna. Thanks.
Absolutely, and I know that as you mentioned, Helen, Brook have done a little bit of work on understanding these intersections, and we did some of that internally, as well as some kind of review of literature. And one of the things that really stands out is that when someone has poor sexual health, there are associations with also having poor mental health, and so their mental health may have a significant impact on their decision making in terms of sexual health. So depression and anxiety have got links with unprotected sex before the age of 16, and so these things just do come together. And more broadly than that, we're aware that kind of if we're feeling unable to make decisions about anything, the decision making, the risk taking behaviors are just it's that link between how we feel and how we behave is kind of inevitably present. But as we say, the research kind of supports that. And internally, what we saw in the kind of conversations with staff at Brook is that link that we've seen, I guess anecdotally, but time and time again within clinic services of healthy relationships and unhealthy relationships, and that link with then both mental health and sexual health, and also low self-esteem being a really kind of key component. So young people often coming in to our sexual health clinics with low self-esteem, with kind of concerns about body image, with that kind of mental health associated concern, which is also leading into behaviours around the sexual health. So we've seen those links kind of in a really data supported way, as well as in just purely in those conversations with young people, where we're getting that kind of understanding. And when we think about identity of young people, and young people, for me, I can certainly speak from my experience in working with young people in counselling, talking about identity in many different facets. So all the different parts of our identity are influenced by our sexual health, by our mental health. They are different elements of that. And it is such a key age, this age group that we're talking about, it's such a key age to develop that understanding of your own identity. And so those links being present in that understanding it's just influences again on both the emotions and the behaviour of young people at that age. So I think I'm just kind of thinking about there was anything else I wanted to add to that. I've kind of lost myself in my train of thought a little, but that those links we've seen in both of those different ways. I think that probably covers what I want to say just in this section.
Great, Natasha and Tamsin, I'm going to come to you both to see if there's anything you want to add, but I'm particularly interested if there is anything you want to add in relation to a couple of things that Emma and Anna have said about they're both difficult areas to talk about, and that they can be really difficult, that they can be associated with stigma. There's a lot of influence around both aspects of health. And also, I think the point that you made, Emma, about the disjointed nature of services, and that although there's health is, you know, a strong point that young people don't silo their own health, but do the services silo them, and does that have any impact? So want to bring you both in, and I'll come to you first, Natasha, if there's anything you want to say, but particularly interested if you had anything to say about either of those two aspects. So Natasha.
I mean, I really wanted to strongly echo what Emma was saying about how our health doesn't exist in silos. And particularly, I have noticed a trend recently in some areas of kind of the NHS even, and amongst some professionals in mental health, to try and present mental health as though it exists in a vacuum, and if it's influenced by other factors, that it therefore can't be real. So, you know, we've had comments recently about the rising mental health issues in young people, and somebody right at the heart of the NHS saying, but when you actually talk to them about it, their reasons are things like exam stress, as though it makes it therefore diminished, less distressing, less worthy of attention. But that's because that's what's happening for young people at that time. And when our bodies feel a feeling, our mind will make a reason, and you know, we'll always attach it to whatever is happening for us at the time. And then of course you've got the fact that, you know, was touched upon by Anna, that our mental health affects our decision making. And particularly, you know, self-esteem is such a huge component. It's a primary diagnostic criteria for all major mental health issues. And if you have low self-esteem, you tend to make poorer decisions when it comes to your relationships and your sexual behavior, and certainly more risky decisions. So I think it's really important to acknowledge that you can't, just as has already been said, you cannot silo those things.
Yeah, I completely agree. I think the thing that stands out for me there is young people not feeling seen and understood. And that's because we're looking at these different facets in isolation. We're not seeing them as a whole person. Why should they trust us to talk to us about these things, which are really personal and difficult, and like you say, maybe subject to stigma? Why would they trust us to talk to them if we don't really know who they are? And we need to be able to build those relationships where we're saying we see you and we see the whole of you, in order for them to be able to sort of to break some of that, the barriers that they're feeling. And I think that is particularly true, just interesting, like on Emma's point about disparities between different communities and people who may be marginalised for various different reasons, and how they find it even more difficult to feel seen and understood, particularly by a health system which is mainly white, mainly westernised, doesn't maybe actually relate or reflect them in any way. I think that's particularly hard.
And I think that leads us on to our next sort of area that we want to explore a little bit more, is what are some of the issues and challenges? It's such a wide and it encompasses so much of young people's experiences and life from so many different angles. It would be really good to kind of explore that a little bit more, what we see and what our views are around some of the key issues and challenges that young people are navigating. So I'm going to come to Tamsin and Natasha, come to you both first, and then Emma and Anna if there's things you want to add in. So Tamsin, come to you first on that. You know, so what from your experience are some of the issues and challenges that young people are navigating?
Yeah, sure. So I think the first thing to say is that young people's basic needs are not being met. And until we meet those, it's really impossible for us to have any kind of meaningful, lasting, impactful support for their mental health or their sexual health or any other part of them. They're feeling like when they do speak up about these things, they're being accused of being difficult, they feel like a burden, they're being disbelieved, as we've already touched upon, oh, well, that can't be real. And they're feeling under so much pressure because of this, and they're feeling ashamed that they can't help themselves. And it's the combination of several broken systems and institutions in this country that kind of interact together, or maybe don't interact as well as they should, which causes harm. And I'm talking about things like our education system, health, youth justice, but also media and the economy as well. And young people are then experiencing a world which is lacking in safety. So they don't feel safe at home or at school or at work or in public. And those who have marginalised identities are even more at risk of being failed by these systems and therefore feeling really unsafe. And young people tell us, and it's interesting, it's already come up, that they have to pick and choose between aspects of their identities. So, for instance, they might have to choose between being mentally unwell or being neurodivergent in order to get help from CAMHS. And yeah, as we've mentioned, just young people aren't being viewed as unique whole individuals, and they're instead sort of expected to fit into these boxes, which are really exclusionary and oppressive and built by the systems that are in place. And we've also found that young people, and by that I'm meaning really young, like primary school age children, are really aware of and really stressed about world events, things that are happening in the globe around them, and things like climate crisis, war, police violence. They know these things are happening, and they see that us as adults are completely powerless to stop them or to fix them. And in some cases, they see us being really actively hypocritical as well. Like a really tiny example of that would be a school child who is being taught about the importance of recycling at school, and yet every day they see their teacher come in with a one-use coffee cup. And they're just looking at us, and they're seeing us as complicit, these older generations as complicit in these broken systems. And they also see that we're not trying. They don't think we're trying to create better support for them. So they don't trust us to make their world better. Recently, Young Minds asked young people from across the country just what it felt like to be a young person in the UK today. And I wanted to bring some quotes, some responses, because I found them very stark and very shocking, and I think they need to be heard. So I'm just going to read a few of them. I feel like my future is pretty bleak. I feel like we've been forgotten. Young people are treated as irrelevant members of society. I'm facing a lot of judgment from older generations with not much support, and feels like a completely powerless existence. Alongside those, I lost count of the number of young people who use the word terrified to describe how they feel. And as a safeguarding professional, what that's telling me, what it's painting a picture of, is this generation of young people who are growing up in a world which is making them really vulnerable to harm and to abuse. Because a young person who feels irrelevant or powerless is not going to be able to develop that sense of self that we've spoken about already, that self-confidence, which can be real protective factors against abuse, radicalisation, exploitation, for instance. And young people who are marginalised and minoritised and experience discrimination, to them, the world feels like an even more hostile place. And I start wondering, how might it feel for these young people when they're comparing their lived experience and how they feel with these sort of shiny, polished lives they see on social media? Or how might it feel to a young person to be approached by somebody who purports to show an interest in them or to understand them, even if that individual has an agenda of racism or misogyny? Now, I wonder why we saw scores of young people taking part in the recent race riots. And I'm hoping that Natasha is going to give us a bit more sort of an in-depth look in some of those things that I've been wondering and thinking about. So how do we safeguard young people in this environment? It's really hard because those trusting relationships are obviously the absolute key. But when we as professionals reach the limit of our remit or our abilities, we feel like we have no choice but to refer back into these systems which are broken and uncaring and discriminatory and harmful. And then the trust is broken again. So this isn't the answer, and I hope we'll come to some answers later on in this discussion. But really, what we need to be doing is looking at all of these interconnections about different aspects of well-being. We need to accept there's learning for us to do, and there's a lot of work for us to do as well.
Yes, Natasha.
So hard agree with everything that Tamsin just said. And she reminded me actually that I've been having this conversation for years and years now, where people have been very insistent that, you know, for example, in the 1950s, you had the post-war generation who had endured a lot of hardships in their youth. And then, you know, if you grew up in the 60s and 70s, it was the fear of Cold War. And then in the 80s, it was the fear of nuclear war. And so when young people are talking about things like climate change and global instability, you have a lot of adults who will say, well, hang on, that's not unique to this generation. And then what they'll usually conclude is the only major difference is technology, and therefore social media is the root of the problem. Now, I'm not saying that technology and social media are not playing a role here, but that always felt like too simplistic a narrative for me. And I'd always put it down to, when I was having these discussions, I would describe it as a lack of community, because that was the only way that I could think of to frame it at the time. But there's been a recent paper that's been published in The Lancet that has really helped me to reform my thoughts on this. And what this paper is saying is that the key difference is neoliberalism, is this kind of hyper-capitalistic, individualistic, competitive society that young people are growing up in, that is working fundamentally against our human nature, because we are tribal animals. We evolved in tribes. We are designed to rely on one another. Community is essential to our mental health and well-being. So if you're growing up in a culture which is putting all of the emphasis on individualism and competition, that's why we're seeing these epidemics of loneliness and related mental health issues. So I think it's really important to bear in mind that it's not just technology and social media that is at play here. There are other influences too. Having said that, I do think from the focus groups that I'm doing with teenagers, technology is a constant theme. Certainly the kind of pornification of the way that they see themselves, as well as the way that they are seeing others, and it's stopping them from forming meaningful connections and relationships. And again, as touched on by Tamsin, when you look at misogynistic influencers like Andrew Tate, and I think it's important to bear in mind that Andrew Tate is the tip of an incredibly toxic iceberg. There are hundreds and hundreds of these people out there. The way that they reel in, and it is usually vulnerable teenage and tweenage boys, they start from a mental health perspective. They begin by saying, hey, are you anxious? Are you uncertain about the world? Your answer to that is yes, if you're paying attention. They then say, do you know that there was a time before you can remember, before your father can remember, probably conveniently before your grandfather can remember, where everyone was really happy? And they use these statistics that do exist, but they've got a correlation causation problem that show that men and women were happier in the 1950s, even though ideas about happiness have evolved since then, and frankly no one cared if women were happy back in the 1950s. So they'll say, look, I've got proof that everybody was happier when gender roles were more conforming. So they say the reason that you feel this way is because of feminism and women's freedom. So if you want to not feel like this anymore, you have to subjugate the women in your life, and I'm going to show you how. And that's how you end up with vulnerable boys saying to their teachers, make me a sandwich, or using incredibly offensive language to the women in their life. And you can see there quite clearly how you've got this link between mental health and then their, I guess, relationship and possibly even their sexual outcomes as well. So I think that's one thing that I appreciate it. And I've been in this situation myself. You know, many teenage boys, they're enormous and they're aggressive, and it's very difficult to look at that person in front of you and go, here's a vulnerable person. But I think if you can possibly bring yourself to see it in that way, it gives a much clearer picture of the genesis of a lot of this stuff.
I think there's some really interesting points from different perspectives that you've both made, and just bringing Emma and Anna in, I think to kind of place these in that bigger picture, and what came through what you were saying, Tamsin, was about young people's voice. I think you say it so well. They don't feel seen and they don't feel heard, and then we ask them about certain aspects of the world and what they think about the world, and then we get an insight to where they are, and then some of the things you've been talking about, Natasha, that they're having to navigate. I just wonder, from Emma and Anna, from your points of view, if there's anything in relation to the issues and challenges that you want to kind of bring into that mix from the sort of bigger picture that we've had from Tamsin, and some of those details around the challenges from technology, and really interesting points about how socially and politically we evolve and change, and our ideas change, and how they then influence and are used. Anna, I think so. Oh, go on, Emma, you go.
Yeah, shall I just, I've got a few.
Yeah.
Sorry, thanks. Yeah, so I think a few just reflections on what I've heard. I guess that I think what you were saying, Tamsin, about kind of a broken system is for me around the capacity of services to respond to the things that young people are experiencing. And we know that there is a massive issue in terms of the capacity of our mental health services, but across the board we have issues in terms of the capacity of health services to respond to need. And I think within that context, young people have always told us that they are often not believed. They tell a health service they've got a headache. Oh, it's just a headache, don't worry. They think that they may have a brain tumor, or that they're very worried about something. But instead of having a conversation with young people about it, there's a kind of sense that, oh, well, it's just, so that not being believed, I think, is exacerbated then by a lack of capacity in services, because there is a lack of time to then investigate and talk to that young person and build a relationship to find out what's happening. And I think that's particularly linked to these kinds of issues, because often young people, the first thing that they want to talk to a health service about is not their main issue. So the presenting issue that they will come with will often not be the thing that they're most worried about. And the only way that you can find out about that is to spend time to find out what's going on. I think the second thing is just reiterating how we must remember that these young people have lived through a global pandemic, and we don't understand all of the impacts of that young people are inherently not necessarily a word I always love, but they do have a huge capacity for bounce back, but it has definitely affected their mental health and also the relationships that they are having. And I think that we cannot underestimate that, and we have to see it within that light. And then finally, I think is really interesting what you were saying, Natasha, about an individualistic society. And, this is the point of life when peers are the most important to us. We move from being in the family to our peers being the most incredibly important part of our life, and we really need to understand how that is impacting on young people. And when we're thinking about solutions for whatever it might be, we always want to think in a more kind of public health approach, in a more community-based approach. So instead of telling young people that they've got to sort themselves out, we need to think about what are the resources, what are the services in that local area that we need to invest in to support young people, rather than saying it's about you and you've got to sort it out. Thanks.
Interesting. Anna, can I just, before you, so one of our participants has mentioned the issue of power, and young people may not always feel that they're in a position to take control of things themselves. And as they, just picking up this point about capacity in services and how services are configured, that being moved through services and waiting lists being bounced around may impact them. I just wondered if, in addition to what you wanted to say, if there was anything you wanted to say about that aspect, about young people feeling less powerful in terms of being able to take control of things themselves.
Yeah, I think it's a really strong point, isn't it? That we, I think Tamsin, you were talking about how powerless young people feel, and that is just added to, isn't it, by those issues. And I think part of what I kind of get the impression that all of us working with young people really try to aim to do, and certainly I know in Brook we do try to empower the young person to be able to work with what they've got going on. So again, in that holistic way, but just in all of these aspects, to be able to have the information, have the knowledge, have the support to make decisions that make sense for them, that sometimes the adults in their lives might not agree with, or might not totally be on board with, but they're certainly the decisions that make sense for them based on actually working it through in a thorough and an understanding way. And I think that there was something about what you were saying, Tamsin, around the kind of the systems, the kind of institutions that have to work because of capacity, as you were saying, Emma. They have to work in a certain way, and it just doesn't fit for everybody. And what we're finding is those young people that feel really let down by those systems, it doesn't fit. It's not working. And so there's something about the importance then of services such as ourselves, that have more freedom, I think, to offer services that make sense to young people, that are led by what young people say. And again, I think we try to empower young people in our approach to actually have a say in how we deliver things and how we run things, because they know best actually what is going to work for them. And I think that sense that we are trying to offer a service that they can engage in, and we get that feedback often that it feels different to when I went to the NHS, or it feels different to what the support I've had at school, or because we are kind of meeting them in a different way. And I think just the sense sometimes it is literally just we've got a different badge above the door, and they've had a bad experience with one element of the NHS, and the whole of the NHS then is to them kind of not friend. So then the fact that we've got a different label above our door means that we are a welcome space to come to, and then hopefully we do meet them on that one-to-one basis, which allows that to be true, I think, rather than unfortunately what they are sometimes left with. Go ahead, Natasha.
Sorry, I was just going to say what you and Tamsin both said about powerlessness. There was something that I wanted to add to that, which is there has, I think, been this tendency for people of my generation. I'm just about a millennial, so our kind of Gen X's and millennials, recognizing that we've messed up, but because we feel relatively powerless to fix things, we look at Gen Z and we go, but they're great and they'll probably fix it. And so what that's translated into is a lot of Gen Z saying, well, so hang on, in addition to working for nothing and not being able to get on the housing ladder and having record amounts of student debt and worrying about everything that's happening, I have to fix society, do I? And that's what you're telling me. So that kind of us looking at the younger generation and recognizing the hope, I think, has translated into an additional pressure for them.
Yeah, I think it's really interesting to me that we're bringing in the kind of the global and that bigger picture. I just wondered if anybody's got anything that they want to add to the issues and challenging part of the conversation before we move more towards thinking about what's helpful and what's supportive and what works, and some of the things that you or that you are working on. I think before we do that, any last points in relation to that? We've had an interesting comment in the chat around how we make the case better for increasing funding capacity and time for those working with children and young people, whether it's more youth work or more. A question about how we might, just worth us bearing that in mind, how we might want to make the case for that more broader and bring the voice of young people more to commissioning, to decision making, to service configuration. Seems really important from what we're saying. Does anybody want to add anything, or shall we move on to look at some of the things that work in supporting young people, some things that are helpful? Natasha, really interested to come to you first on this in terms of some of the work that you talked earlier about, seeing where young people feel the gaps are in their PSHE and where PSHE and RSE come together, and some of the work that you've done around that, and obviously anything else related to what you feel works. But I think you've mentioned a couple of the real kind of thorny issues that young people are navigating. So in terms of what helps them through navigating that, would be really interesting to hear. And then Emma, Tamsin, we'll come to all of you after that.
So I wanted to say that whenever we have conversations like this, you always end up reaching the conclusion that what's fundamentally needed is a revolution, and that feels really overwhelming. And there's something that I was told very early on in my activism, which really helped me, which was think globally, act locally. Even though these are huge issues, we all have our own circle of influence, and we all have a community that we have the power to make a positive change to. And I always think of it as like a patchwork quilt. You know, you've got your patch, and when we sew all of our patches together, we create something massive. And you can do really simple things with young people that make them feel seen and heard, and that intervention can be incredibly powerful. So to give you an example, just recently, I discovered a thing in West London called the Offline Social Club, which is literally, there's this wonderful woman who rents out a town hall, and she invites whatever local teenagers want to come along, but there's normally between 10 and 20 of them, and they all put their phones in a lockbox. And then for the next 2 hours, they can do whatever they want. There's music playing, there's games, they can draw, they can write, they can just chill and listen to the music, but it's permission for them to be offline and away from their phones. They can chat if they want to. It gives them some respite. It was such a simple idea, but talking to those young people about the power of that, and knowing that their phone is locked away and they can't look at it, and having somebody else kind of in charge of that, just incredible for them. That in the focus groups that I do, there's an increasing desire for the psychology of stuff to be spoken about. So, for example, all teenagers have the same story about their social media education, certainly in the state sector. And it's a police officer came in and told us what would happen if we had naked selfies on our phone, whether that's of us or of someone else. And that's really the extent of it. That's an important lesson. I'm not saying that that's not, you know, online safety is definitely part of the picture, but they were much more interested in the psychological aspects of social media use, how to navigate that world, really granular things like how to spot fake news. And that's what's, I think, missing from the picture. I would like to see schools being given more autonomy to be able to actually talk to their cohort and to adapt their PSHE and RSE according to the feedback that they get. Because when you do that, you know, different communities have different challenges, and you're never going to have a one-size-fits-all approach that's going to work. It's great that there are statutory topics on the curriculum, but when you really listen and feedback according to what they want, I know that that's incredibly appreciated.
Really interesting. Tamsin, is there anything from you that you would say is particularly has been helpful in terms of supporting young people to navigate this?
Yeah, I think one of the big things that I've been noticing for a long time really is that the main safeguarding concerns that are coming up for charities and organisations like ours are around mental health. And that is no matter what the focus of your organisation is, you know, whether it's sexual health or cancer or guide dogs, it's all about mental health. And there is this tendency to be nervous about managing mental health support, particularly when it comes to a crisis situation. And that's where people feel underprepared, and then they instinctively just want to pass that on to someone else, to a specialist system. And as we've mentioned, there are huge capacity issues in the system. It's not always actually the best thing to do for that young person. So I just think we need to sort of reframe what responding to mental health is, and all it is you being a human being responding in a human way to another human being standing in front of you. And actually it can be really simple, and things like just listening to somebody, validating what they're experiencing, just giving them that time and space and compassion. Like, we can't fix it for them. I mean, we've talked about how massive this is. We can't fix it. So we should stop worrying about the fact that we can't do that. We just need to get down to that kind of individual level. And I absolutely agree with Emma that community is key to this, and that we need to be really open to what community is. And that might be family, or it might be faith-based, or it might be a sports team. But those are the sort of spaces that can give young people individual nurturing and can actually really care for them in a way which a massive organisation or institution just can't. And it takes much more time and much more effort and much more humanity to respond in that way, but it is the right way to respond. And I think, just sort of building on something else that's come up about the difficulty in translating this, I think sometimes to our leaders or our funders in particular, that's really hard, because we need to just stop treating people as numbers, and instead we need to help those people who are devising our strategies and who hold the money to understand that we're looking at really long-term, like lifelong benefits of the impacts that we're making. We can't just reduce human beings to this kind of set of KPIs. So I think the ways that our organisations can help young people and help them get through this really challenging part of their life is to become more human, like avoid putting those sort of pressures to be perfect or to be productive that we feel as organisations and as people who work in those organisations. We need to stop putting those pressures onto young people as well, and just accept that everybody's path to wellbeing is going to be different, and it's going to be messy, and it's probably going to be really long, and that's okay. And I think if we can start feeling that ourselves, that will translate to how young people feel when they approach us and our services, and they will feel like it's a service that is set up for them.
Well, they're such important points, Tamsin, and I think the point about the nervousness is such a, it certainly resonates with us as we were moving to respond, to make sure that we were safe at that point of a crisis. And I think what you've just said, and kind of integrating that into the way that we think about, because you have got to have emergency and crisis responses. We need to know what to do, but I think how we shape that and how we deliver that, and that just bringing that very human element to it felt really important and really resonated with where we are. So Anna, I wanted to come over to you to see what you wanted to say in relation to what we find helpful and how we're thinking about things at Brook in relation to that development.
Yeah, so I think because, as we say, we've been kind of working with these things, running alongside inevitably for such a long time, and we have had counselling services within Brook for a long time, but we are really kind of wanting to kind of make that more of a actual offer, I guess. We've been doing My Life for a long time, which is a programme that really works on the health of a young person in various aspects, kind of a really holistic approach of my life. And so it's about the young person's life, and that encompasses anything and everything which is within that, but with a focus on kind of health and improving things, which is a one-to-one programme with young people, and been delivering that for, I want to say 8 or 9 years now, I think. So what we're developing now, and what we have in 2 locations now at Brook, is a hub for wellbeing. So that will offer the My Life programme, but also a mental health literacy programme, which is designed to really support a young person to understand mental health, what that means, what good mental health is, what poor mental health is, really understanding that, because there's something in that about mental health being something that is relevant to all of us, not just those of us that are struggling. And so that mental health literacy program being quite a structured program, but one which supports the young person to understand what mental health is about, how it affects them, what does that look like. So that, again, we're talking about really empowering those young people with that information. And then also counselling, and having those things all within one hub, so that we have counselling, mental health literacy, and My Life all within that one space that people come to and know as that place of getting support. Along with that, recognising that being part of a group is also where good learning can happen in that aspect. So we have our mental health literacy program, which is for a group as well, delivered in a slightly different way. So all of those things we want to kind of really encourage young people to have that information, to have that knowledge, to be able to then self-help essentially, but not just now, throughout their lives, as you were saying, kind of really developing that as a long-term thing rather than just a short-term fix, if you like. And we've worked with young people to kind of understand what they need from it. We've talked to young people about what they want in that, and we're really trying to make it a very collaborative kind of approach. It's self-referral, and that feels really important too, that young people can decide to do this, not be, you know, go along to that will probably help you, from an adult that might be very well meaning but not necessarily know where the young person is coming from. So that's where we are in terms of developing those projects. And I think there's a couple of things that I wanted to just pick up on, and I'm losing track of my thoughts again, but I think that thing of the community just feels so important, because actually where we can connect everything we're saying, you know, relationships are so important at this age, partly because we are at this age developing away from our family into those peer relationships. That's what is the drive, this innate drive that we have as a teenager, is to make those connections. And this link with social media, that actually young people can be kind of making those connections online, but not necessarily in person. And that's a really mixed kind of feeling for a young person, that they can be so connected but feel so alone, as opposed to being kind of as at that, what you described, Natasha, that group where they leave their phones in a box, that actually that kind of is that face-to-face connection, that they're I think sometimes when you've got a kind of like a smoke screen of something, it's almost like when you're connected online, you think you've ticked that box, you think you have all those connections, so you don't realize that it's missing. But then it's only by doing something like that you might realize, oh gosh, yeah, this is me. Or when crisis hits, when you suddenly feel alone, because actually maybe none of those connections, and I'm not saying that all non-real life connections are not connections, but there's just a different quality to it. And I think where we can make connections for young people to feel part of something, that is real and tangible, and, you know, in real life, IRL, like that matters, doesn't it? It really matters. So particularly when we're talking about how relationships are such an important part of both sexual health and mental health, it all kind of pins to that, doesn't it?
Great. Emma, great points we're all making, aren't we? There's so much to think about.
So much to think about. So
Yeah.
I've got 3 things that I was thinking about. I've looked at some of the questions as well, so I might kind of point to some of those. So I think the first thing is that, you know, this is huge, as Natasha was saying, and I think Tamsin said, what can we fix? And that was something that we looked a lot at when we were starting a 3-year program of work on health inequalities, and we created a model to look at health inequalities for young people. And one of the reasons for doing that is because otherwise we kind of say, well, it's poverty, it's all of these, you know, the issues that we don't have power to do anything about. But in the middle of that, there are some really key drivers, and one of those is access to services. And we can do something about access to services. We can do that about community services. We can do that about services in the voluntary sector, but we can also do something about access to NHS services. And we're really passionate about, you know, thinking that if we're going to get it right for young people, we've got to get, you know, it's not about one or the other and saying one service is better than the other. We've got to think across the piece, and we've got to look at, for example, accessibility of primary care for young people. More young people are registered with primary care than not. Often primary care practices don't think that young people are part of their population, their primary care population, but they are. And we need to be thinking about how those core NHS services are more accessible to young people, that they understand young people have capacity and they understand issues around consent. And, you know, young people can access the NHS app from age 13, and they should be able to see a general practitioner on their own. But not many people really understand that. So I think really sorting that out and advocating for that to be better, but also working via schools and PSHE and RSE to enable our young people to understand their rights around their own around and their health literacy, and I think then that kind of cuts across the sexual health and the mental health piece, and I think we need to be brave, and we need to be able to do that with all young people. Some of our work with young people who have been affected by sexual exploitation and abuse has really taken a very much rights-based approach, and we've navigated that in a way that is safe and supported. But those are young people who really want to be heard, who really want to be part of the solution, but often professionals are too nervous and too worried about the risks to have those honest conversations with those young people who have had the most challenging and difficult experiences around their sexual health. So I think that access bit is key to me, and we really need to work on that. And then the second thing I wanted to pick up, which is one of the questions, is around power. And I think for us, you know, over the last couple of years, we've been developing a programme of training, working with young people affected by all kinds of health issues and by health inequalities, to work with us to co-plan, co-create and co-deliver training for health professionals, or for all professionals, for researchers, forever. And that, I think, has been a really, really important process for us as an organisation, but also leading to a resource which I think is really important for sector, and there will be other models out there as well as ours. But that is really helping health practitioners and those who are leading work in this area to be led by young people, to hear from young people directly, and to try and create solutions with young people around issues of youth-friendly approaches or health inequality issues. And so I think we need to all be really kind of thinking about how we are ensuring that we have got young people leading that kind of things at a more systemic level, in terms of the training that we have in our own organisations, the training that we're trying to get commissioned in local areas. And, you know, we're often leading co-production, but very often people don't really understand that co-production means sharing power with young people, and we really need to be ensuring that when we are doing it, that's exactly what we're doing, and we're listening to people. So there's something, there was a question a bit about that. And then I think the final thing was just about capacity of services. And I do think, I'm not saying it's an easy thing, I think it's a really complex thing, but when I've done work with complex families and young people living very complex lives, I think this way that we silo the system leads to huge duplication. If I, you know, have young people who have like 3 different key workers for different parts of their health experience and journey, we need to think more carefully and more radically about how services link together, because a young person or a family, oh, that's somebody, probably my young person ringing me, so we need to think about how those are more connected together, and that we, you know, if young people have those trusted relationships, that they don't need 3 different key workers, they need somebody who they can really trust and who can help them to navigate those things.
I wanted to pick up a point as well and ask you a question around online services and digital services, because we've at Brook, we've developed our digital front door over the years, and we encourage those services provide access to a range of testing, treatment, and access to information support, so people are in a position much more to manage their sexual health in a way that is meaningful, in a context and an environment that means for them, that means something to them, in a way that perhaps, had we looked at it, certainly when I first joined Brook, we would have been certain that they needed a consultation and certain that they needed the direct support to do that. But as we've developed those services, they're really, young people are taking them, using them, our adult population use them. So I just wondered what our thoughts were in relation to the digital services, information online, forums, what were the positives potentially around that, and anything we needed to be cautious about. Just interested in our views. Natasha, is that something you'd like to comment on?
Sorry, I was just answering a question in the chat from Georgia, who she said, what's the neo word that I used earlier? And it's neoliberalism. And if you're interested in finding out more about that, there's a book that came out recently called The Invisible Doctrine by George Monbiot. It's not a long book, but it gives a really comprehensive overview of neoliberalism and what it is and how it's the water that we're all swimming in. In terms of online services, I think it's important to understand that the way that people who didn't grow up with the internet view the internet is very different from the generation who were born online, essentially. So I had a conversation recently with some teenage girls who I was talking to them about. There is a campaign which is largely run by parents, which wants to make it so that young people under the age of 16 would, by law, not be able to have an app-enabled smartphone. So they would only be able to have, I think it's Google Maps, their music, and something like Childline, so that they would have the ability to get information for their mental health. But other than that, there would be no Snapchat, there would be no TikTok, nothing like that on their phone. And I said to them, do you think that would be a good idea? Because I think it sounds like quite a good idea. I think it needs to be thought through, but fundamentally, I think it's quite a good idea. So I said, do you think it's a good idea? And they all immediately said no. And when I asked them why, they said, how would we know anything? And I thought that was such an interesting response. And I actually said to them, well, how do you think I knew anything? When I was your age, how do you think that I found out information? But for them, their phones, the internet, social media is their primary source of information, which is why it's so important. I think the future of education is going to be less about remembering information and more distinguishing between reliable information and propaganda or fake news or bad science. So online services, whilst for some young people, it would be more advantageous to be face-to-face, I think they are such a vital part of the picture, because young people are going looking for the answers online, and there has to be someone reliable and evidence-based and trustworthy there to provide that for them.
Great, thank you. Thanks, Emma.
So I absolutely agree. I think it's really important that young people have trusted information online, and young people want to have sources of information that they can trust about their health and well-being, and particularly because of coming back to what we talked about at the beginning, these are issues which are sensitive and difficult to talk about often, so they want to be able to navigate that, and they want to know what they can trust and what they can't. But I think we need to give young people the choice to have face-to-face services, and many young people for these issues do want to have an element of face-to-face, or an element of face-to-face. They want to be able to talk to somebody about it. And sometimes I think we do have some concerns around a wholehearted move to that kind of online delivery, if that doesn't allow young people space and time to explore, as you might do, in creating a relationship with a professional to unpack some of these complex issues. And so I don't think that's what you're suggesting, Helen, but I think that is something that we have to really think about. And I think finally, sadly, there are some real barriers for young people. You know, young people, when many primary care services moved to mostly an online gateway, were excluded from accessing primary care services during the pandemic because of their age. So we need to really think about the way in which online systems work for young people, and how we ensure, for example, you know, when a online record moves from the parent's responsibility to a young person's responsibility, things, you know, if we're not good about getting those kind of things sorted, young people will not share their concerns about their mental health and their sexual health if they feel that that is something that their parents are going to be accessing. So I think we need both. We need to just make sure that young people are clear about what trusted information is out there, and then we also need to be really clear about choice for young people as well.
Yeah, and we definitely we did a lot of work to ensure that our digital services, and there was consideration and real detailed consultation about which aspects would work. I think what I was interested in exploring is some of the things that we thought might never work. It is possible to make them work, and increase that autonomy and self-care in the kind of world that Natasha's talking about, where that's what they're born into, and that's where that they're functioning. So yes, absolutely, we yeah, just wanted to reinforce that point. Anna.
I just wanted to add in, because it feels like a couple of things that have just cropped up in my mind around that, is that what you were saying, Natasha, about how young people now have a totally different relationship with online life that we can't really, and I'll say we, because none of us are of that generation, we cannot completely comprehend that as much as we might understand part of it. It's like we're talking a different language sometimes. And the difficulty we have there then when we're offering digital services is that our version of it might be different than the perception of it. We're kind of talking across a language barrier almost. So there's something in that is just worth having in mind. I've not quite made sense of it myself yet, but I think there's something about the fact that our perception of how that online interaction happens may be different to what the young person's perception of it is. And then the other thing that I was thinking about was what Tamsin, you were saying earlier about kind of being human, and being human is you know, happens most naturally, I think, in person with somebody, purely because that's how, at least I can talk from my experience, that's how kind of it feels most natural. But actually it's about that communication, however that happens, really, isn't it? So there's something about the kind of that could be digital, it could be in person, but I think there's something more instinctive about it when we are person to person, in that we are picking up on so many cues that we may not have digitally, and extra information that we don't even know we're missing sometimes. So I just wanted to kind of bring up those points because it felt like it joined them together a little bit.
Well, we've had some questions through, so we'll look at a couple of the questions that we had. Oh, Tamsin, did you want to come in there? Sorry.
I was only going to very briefly add
No, please.
I just wanted to hark back to, again, sort of tie up some loose ends, I think, a little bit, that online services, I wouldn't demonize them at all. I think they can also provide community. And when we were talking earlier about how community can be lots of different things, and I think it can provide that, but I also think it's absolutely key that those communities are co-produced and co-created by young people in that sense of sharing the power of what it's going to look like and what it needs to be that Emma was talking about, because otherwise, as Anna's saying, we probably are going to miss the point a bit, you know, as people of a different generation. I think if we can find ways to do that, where access to services online or access to communities online is created alongside and with young people, then that could be really valuable. And the sort of the safeguarding manager in me also thinks, eek, that's going to be really difficult to moderate and keep it safe, and what do we do? But I think there are ways that we can do that, and actually we need to not be scared of it. You know, if that's one of the solutions to the problem, we need to go for it, and then it's our responsibility to help find a way of doing that. And young people will show us as well, and will tell us how to keep them safe. You know, I don't want to devolve all responsibility to a young person or a child, absolutely not, but actually, so long as they're part of that process, we can create those spaces and make them safe. And often I think we'll find that young people sort of find their like affinity groups online. You know, they find their people that they want to be with and understand them, and that's such a powerful thing that might be quite hard to recreate offline. So again, I just think that's absolutely something for us to keep our eyes and ears open about. How can we do that and do it better all the time? Thanks, Helen.
Yes, no, thanks. And I think that was definitely a journey that we were on in relation to moving to any of our services online, to ensure that every step was measured, but also there was that element of, I wouldn't say fearlessness, but courage in finding the ways to make that work, to make that safe, and to make that really usable to a young person in their life. So now we'll go to a couple of questions. So there's a question that we've been asked by one of our colleagues who's listening, who works for a large NHS mental health trust. And they say that a lot of their young people also have a learning disability and or autism, and a lot of brilliant work takes place between regards to the mental health. But the area that trips a lot of staff up is supporting young people with the sexual health and sexual well-being side of things. And being involved with an NHS service, it's often seen as a safeguarding issue, which shouldn't be the case. So, our colleague here wants to know what our views are on that. So that was why I was going to come to you first, Tamsin, on that, and then over to you, Anna, and then Emma and Natasha for you to add anything in. I think it's the point that there's work there around mental health, and that feels very comfortable and really brilliant work, but where there's a bit less certainty, or as it's described, trips people up, is the sexual health side, and it can be treated as a safeguarding issue when it may not be.
Yeah, I find this really interesting that that's the bit that's tripping them up rather than the mental health side, because I think often it's really the other way around. And I think to me this speaks of a sort of culture which is perhaps unwilling to see those young people as their full selves, and also I'm not sure exactly how old these young people are, but also really understanding the differences between, you know, a 13-year-old and an 18-year-old and a 25-year-old. Potentially there are huge differences there in how I might answer this question from a safeguarding point of view. And I think when we tend to sort of lump young people together under that banner, we're at real risk of like either infantilizing an adult or adultifying a child. And I think maybe that doesn't help in this situation if the staff in the situation are thinking about a young person and not thinking about this individual who is this age and has this needs. Because certainly a young person with a learning disability or who is autistic, you know, could and should be exploring their sexual health, their sexual side of them, and they can absolutely do that in a way which is safe. So I think having that kind of immediate panic response of this must be a safeguarding issue is relatively unhelpful, because I think it also doesn't allow us to learn, you know, how, as you were saying, Helen, like not being fearless, but being courageous, being brave, like being bold, and thinking what would happen if, you know, how much do we actually think there is a little bit of risk here that we could hold, and that's absolutely scary as a professional, but we can do it. You know, we can push ourselves to hold a little bit more risk for the sake of a young person's well-being, you know, where we think actually that is overall going to lead to them having a fuller life. So that's where I would be challenging, I think, this team and perhaps that mental health trust to think a little bit more boldly about how they're responding to these sort of concerns as well.
Thanks, Tamsin. Anna, is there anything you want to add?
Just everything that Tamsin said, like I really I think you answered that really well.
We'll tick those.
Tick those. And then just I think you're right, it's an area particularly around learning disability and autism, and you know, that sexual health can be such an area that people kind of panic about and unfortunately get wrong because of that panic, or because of not seeing it for the kind of wider picture that it is. And there's a note in this question as well, it's that these young people are often also on the fringes of their peer groups because of diagnosis or because of their hospitalization, or, you know, those kind of additional reasons. And I think that's such a large part of, you know, when young people are kind of first exploring their sexual lives, it's often peers that they would talk to about that. But when they don't have that and they're kind of talking to other people, it becomes this much kind of more big, intense conversation, as opposed to the little questions and things that young people say to each other when they're just figuring stuff out. So I think there's something about the kind of understanding really the context of what is or isn't happening, and B, the training. I think there's a real, and I don't know in terms of what the NHS receive in terms of training, but my sense of kind of what training is received, particularly around the kind of rights of young people, whatever their disability, learning needs, you know, understanding kind of all of that as a professional who may not always work in that field. I think that's a real gap that can cause a lot of problems for young people. So something that needs a bit more focus, probably.
Emma?
Can I say something quickly? Yeah. So I was just gonna, I think the really interesting thing for me of this is this kind of sense that there's a risk of having the conversation. And my pushback, my kind of response would be, well, what's the risk of not having the conversation? What is the risk of not raising these issues? And I think often we think, are we introduced, and this happens a lot in mental health, and you know, I've done some, I'm not expert, but I've done some youth mental health first training, and a lot of concerns about, are we introducing these concerns to young people? But there are real risks of not having the conversation, and we have to accept that young people are living complex lives and that all of these things at their stage of development are going on. So having the conversation is really important, and that is not as long as we're having safe conversations and just listening and hearing what young people have to say, but also talking about things frankly, openly and accurately and honestly, then that's absolutely what we should be doing. For me, there was a question about from the Mental Health Trust and also from a primary care setting. I think, as well as thinking about how we engage individual young people, I would really encourage services to think about what are the participatory structures that they have for involving young people in a more kind of service development kind of way. If we can think of simple ways, that could be connecting with a local youth organisation, it could be by connecting in with an existing group of young people. We doesn't have to be setting that up for yourself, but if you can find ways of young people being more involved systematically in your service, then those are conversations that you can have directly with young people, so that you can improve those kind of mechanisms to service development. And finally, there are a lot of national conversations happening at the moment with NHS England around learning disability, autism and neurodiversity. And I support the young people who are on the NHS Children and Young People's Board. So I think how we kind of link some of those things up with mental health trusts is really important, so that, again, it's not just, happening at this level and not there, that there is a kind of flow through and kind of challenging the system and the NHS and organisation like ours to do that in a better way, I think is really important, so that we can share some of that learning.
Great point. Natasha, did you want to come in, or?
So there's nothing that I can say on this particular question that hasn't already been said, but there was another question in the chat that I wanted to just say a few things on, which was somebody asked if I had noticed a divide in girls becoming more confident and boys kind of gravitating towards Andrew Tate style ideologies. And this is a generalization, because obviously you can't make blanket statements about such a diverse group of people. Young people aren't a monolith, but that is definitely a pattern that I have noticed. And I think that we have to bear some responsibility for that, because something that I've noticed in recent years is you have these perceived male traits and perceived female traits. And when a girl owns a perceived male trait or goes into a perceived male subject or profession, there is an enormous amount of support for her in doing that. If a boy expresses what are perceived to be female emotions or has aspirations to go into what are perceived to be female careers, there is less support, in my experience, and less championing of that boy to do that. And ultimately that comes down to misogyny. Like there was a school that I went into where they actually did a sort of very basic study where they showed a girl dressed as a kind of engineer and then a boy in a tutu, and then just asked them to rate how they felt on seeing those two images. And there was a lot more positivity for the image of the girl than the image of the boy. And that boils down to the kind of diminishment of anything feminine. So it all has its root in misogyny ultimately. But what it means is that sort of, if you look at the social trends, girls have moved into the male space and then the boys and men have nowhere to go. They're like, okay, well, we've just been squeezed out of having a role in society. So something that I am doing is I am collating a list of positive male role models who are showcasing masculinity in a positive way, whether that is making space for men to talk about their mental health, whether that's detoxifying fitness and being more sensible in terms of the messaging around health and fitness, whether that's talking about religion and you know, how to be a religious young man in a way that isn't oppressing anyone else. I'm keeping this list and I'm sharing it with schools because I think that boys and young men really need to have that behavior role model and someone to show them how to do it.
Oh, great point. So we could just continue the conversation, and the more people that we would involve that have been listening to us, it is a really rich and interesting and beneficial conversation. But sadly, we're out of time. So I just want to say thank you to Anna, Tamsin, Natasha, and Emma for such a really interesting conversation, and I think their ideas, certainly for me, they will percolate for a while, because I think there's a combination of big thinking and thinking at that level, but also very simple things that we can do that are down to our human interaction with each other. And thank you to everybody for committing your hour and a half to us. And we hope you'll check out our social media channels to see what else is coming up this week, and you'll pick up these conversations with friends, colleagues, and wherever else. It would be fruitful to have those conversations. We want that to keep this momentum going. But thank you genuinely, Emma, Anna, Natasha, and Tamsin, for a great session. Thank you very much. Thanks, everybody.